Welcome to Community Watch, and today we're discussing COVID-19 again. Stay tuned, Community Watch starts now.
Welcome to Community Watch. Greg, how are you?
Fine, brother, and yourself?
I'm all right. And as I think we've mentioned before, these days when you ask how people are, it's a much more serious question.
Well, are you COVID-free at least?
I am, as far as I know. I'm symptom-free, that's for sure. And I'm all vaccinated, as I know you are.
Correct.
And our guest today has become a regular on the show, and although I'm always happy to see him, I'm sorry we're talking about the same thing and not some new problem. But I'm happy that he was able to join us today. Dr. Gary Voccio, welcome back to the show.
Thank you. I'm glad to be here.
Now, I'm going to read your title as I remember it. You better correct me, though. You are the Health Director for the Georgia Department of Public Health Northwest Health District. Is that correct?
That's right. Yes.
All right. And first of all, how are you?
I'm well. Working every day. I thoroughly enjoy it. It's different than what I was doing for the previous 3 decades, but I enjoy working with the people I work with and helping the community.
Well, we definitely need to talk about where we are with the pandemic, which has taken another kind of dramatic turn here. And I guess I want to start out with where our vaccination numbers are now.
We are seeing a significant slowdown from when we first initiated vaccines, of course, when they came around in January of this year. Really slowed down. Over the past week, however, we have seen a slight uptick in vaccines, but very, very slight. In general, Northwest Georgia, our population has been vaccinated. About a third of the population has been vaccinated, depending on which county you look at. I do have some figures here. For example, Catoosa County has around, let me look here. I've got it in another sheet. 39% have received one dose. 30% of Catoosa population has received fully vaccinated. For example, Dade County, 29% one dose, and 26% fully vaccinated. Floyd County, 37% one shot, and 33% fully vaccinated. So in general, it's about a third of the population when you look at all of our counties in Northwest Georgia.
Dr. Voccio, while you got your sheet out, it is 2 counties I'm particularly interested in, Chattooga County and Walker County. I know historically they've had a lot of health issues.
Yeah, Walker County is about the same. Walker County, believe it or not, I did not write those down. I wrote down other counties. Those were generalizations, but Walker County is about the same. Walker County, as I recall, looking at them earlier this morning, it was about, I want to say 30% and 26% or something like that, very similar to Dade's. Dade is 29% and 26%. And they're about the same. In general, if you say around 30% or a little over 30% for one dose and around 30% for fully vaccinated, you're going to be close to spot on, Greg.
Now, is any one particular county doing, considerably better?
No, Floyd County in general has had a little more percentage-wise, usually a 2 to 3 percentage-wise points over our average. and in general, usually over all the counties. And I frankly think the reason is because we have a very robust medical community in Floyd County, and people who are, medically oriented or know someone who's medically oriented. And, we have a lot of nurses at both hospitals and Harbin Clinic, and a lot of physicians. So I think that was the impetus initially, and it's continued here. And I think that's frankly the reason we see a little bit more in Floyd County than other counties.
Those numbers have got to be a disappointment to you.
Very, very much so. Yeah. The state in general is about 40% vaccinated, and today the United States reached 50%. But we are very disappointed. And there's just a lot of residents and hesitancy and apathy, I guess you could say. I think people, people have a lot of reasons not to want to be vaccinated. And I asked a friend of mine who called, and she has a medical condition that truly warrants her getting a vaccine, and she just hasn't bothered to get one. She's afraid, and I'm trying to persuade her to do so. But be that as it may, it is disappointing.
Dr. Voccio, you just said something I think we really have to talk about. And you said she is afraid. And I guess that's what mystifies me is, what are people afraid of compared to the alternative of knowing what could possibly happen if you do get COVID?
Well, she listed a whole list of disorders you can get from the vaccine. And I said, the list of disorders from getting the infection far, far outweighs the list of disorders you get from the vaccine. And I told her, I said, getting sick from COVID, you can be sick with this post-acute syndrome of COVID or long COVID for months and months and months after you are over the infection, as opposed to having a vaccine where you spend a little bit of day with maybe a low-grade temperature or just malaise, and that's 24 hours. But 20 to 50% of people now, according to some of these virologists and experts in this field, are saying that 20 to 50% of people, after they've gotten COVID, Greg, are getting this long COVID or post-acute sequelae of COVID. 20 to 50%. And that's, fatigue, shortness of breath, inability to concentrate, poor thinking, mentation is off. Who wants that? I mean, in public health, we're again really trying to strengthen the vaccine need out there, doing things like this and et cetera. But it's just remarkable. It is disappointing.
Now, I know, Doc, you got a lot of questions, so I'm gonna get mine in quick. But is this common, I guess, even with the flu? I mean, so this hesitancy to getting the COVID vaccine, is this common with other vaccines?
No, I think there's more. More vaccines that are accepted. The flu vaccines, for instance. I think more people get a flu vaccine that are wanting to get a COVID vaccine. I don't have the data in front of me, but I really think that there's a significant hesitancy here in this vaccine as opposed to the flu vaccine.
And the reason I ask that is because when I'm talking to people, because here in Northwest Georgia Housing, we do through the Envision Center, we've done vaccination events. Through the 100, we've done vaccination events. And when I'm in the community, I'm talking to people, some of the reasons that they're giving me, I'm not saying they're not valid, but it seems to me they're based on things. For instance, with African Americans, some African Americans, they bring up the Tuskegee experiment, bad blood.
Yes.
And I just don't know how valid that is. We're talking about something that is documented in history, decades ago, compared to something that's happening now. So I'm wondering why people are even referring to such things when we take other shots, we take other medication. If that's the case.
I agree with you. And the horrible events of the Tuskegee was not giving treatment. Absence of treatment. This is trying to help people with the treatment, more or less. And that's what I express to people. There's a grave difference between the two. A grave injustice for the first one, and this one is the current COVID vaccine is trying to help people, to keep people from dying. And, millions of vaccines have been given around the world. Granted, there are a few side effects, but, they are just minimal. I mean, 2 out of every 10,000 people will have some sort of side effect from this vaccine in Georgia. We know that it's 0.0023%. And that's a significant, significantly low number when you consider it.
Well, Dr. Voccio, would you say that our issues with this current resurgence and the Delta variant are the direct result of a lack of people getting vaccinated when they should have earlier?
Absolutely. There's no doubt. The vaccines work, and the vaccines work against the variant not as robustly as the alpha, but definitely that's the reason. The vaccines stop the transmission from person to person, and that's the reason we're getting this Delta variant. Absolutely.
Now,
Go ahead, Doc.
I was just going to say, I have heard some people say they're waiting for the vaccines to get the blessing of the FDA?
FDA.
I don't know if that's, you get the feeling that once that happens, they'll just come up with a different reason, but when is that likely to happen, or do you have any idea?
I've heard anywhere from late summer to early fall, and that's the only information that we have received in that regard. Yes, I've heard that too, but then that number is anywhere from what I've heard and seen and read, 10 to 20% of people who are not vaccinated yet may get it when it's FDA approved. So that's a good number, but it's not where we need to be.
But I have to agree with you, Doc. I wonder if they would come up with another excuse, because I was having this discussion the other day, and I was saying, well, there's a lot of medication that's been approved by the FDA that has to be recalled. So just because that in and of itself is, to me, is not a reason not to take the vaccine. But I'm just going to call it. How much of this, or I think a lot of this, it's just political. I think it's political. I think a misinterpretation, a misrepresentation of the vaccine has been put out. I think this virus has been politicized, and I think we have people who are just dead fast and are not going to get it because of those reasons. And I don't know how we reach people with that mindset. I just don't know what we do.
It has become political on both sides, or more than both sides of the spectrum. And we just have, at Public Health, we're just asking people to come in and get a vaccine. We're doing it a little bit at a time, one arm at a time. That's all we can do. We have Floyd Medical Center, for example, has been going to certain spots around town, hopefully giving vaccines when they can. And every shot and every arm counts, and this is so important. And we appreciate their assistance.
Well, we are coming up on our first break here shortly. Let me reintroduce you, although everybody knows you by now, I'm sure. Dr. Gary Voccio, Health Director for Georgia Department of Public Health, Northwest Health District. And we have a lot of discussion coming up. Do not go away. We'll be right back.
Rome and Floyd County, we've created a huge problem. Litter hurts us all, our environment, our health, and our property. But we can do better. Starting now.
Starting now. Starting now.
Starting now. We can become a litter-free community. Visit keepromefloydbeautiful.org to learn how. Starting now.
Welcome back to Community Watch. We're having a conversation with Dr. Gary Voccio, the Health Director for Georgia Department of Public Health Northwest Health District. And I know, and Greg, you may find this true also, but we deal with, I know a lot of college age students, college age residents. And I think there are a lot of them that are reluctant to take the vaccine, not necessarily for political reasons, as much as just the fact that they are young and invincible. And this started out, at least, as an illness that affected the elderly, older folks, people like myself, and that made them feel even more so unnecessary for them to be concerned. But haven't those tendencies changed now? Aren't younger people getting infected?
Oh, certainly, yes. We've had a significant increase in the Georgia numbers over the past 14 days, 177% increase in cases in the past 2 weeks. And the median age is age 40. So yes, certainly the ages are coming down to, very, very youthful. So we've had a slight increase in childhood cases. Not really hospitalizations of childhood cases, but a slight increase in the children. But the age range that we're seeing the most significant spikes are, between ages 18 and 29. That's the highest number. That's about a quarter of our cases, 18 to 29 years of age. So that is also the worrisome thing, is, the youthful people getting the COVID and experiencing relatively mild symptoms. They're not being hospitalized to a great degree. It's the older people who are unvaccinated, but we don't want them to suffer these long-term effects or spread it to anyone else in the household too. So that's the other concern we have.
Now that makes sense to me in regards that if the age group that you see the greatest increase, is it because we've done a much better job of vaccinating the elderly? And so those that are more vulnerable right now is a younger population.
That's exactly right. It was first and foremost getting the elderly vaccinated, the 65 and above, when we had limited vaccine. But now, it's anyone can get a vaccine. We have ample vaccinations available. But yes, and that's the disheartening thing about not getting to the younger folks to get vaccinated.
Well, we have evidence now. I mean, I do feel that we still have a great deal to learn about about COVID and also the vaccines, but there's plenty of good evidence now that the vaccines are effective, that they work, and that they prevent serious illness in the ones that are vaccinated. We have good evidence of that, correct?
Absolutely. You're less likely to be hospitalized and much less likely to die. The statistics are extraordinarily different between unvaccinated and vaccinated people by factors of thousands. Yes, in the people being hospitalized, and the death rate is going up. I mean, we have had more deaths, and those are in the people who have been unvaccinated.
Because I know there has been some concern about cases we're hearing of people who have been vaccinated and still catching COVID. But those cases are extremely unusual. And when it does happen, it's very rare for them to be serious cases.
That's exactly right. And those are the breakthrough cases, yes. And you're not going to be as sick. You will shed the virus much, much shorter. You most unlikely will not require hospitalization, and the chances of death are close to zero. And this was proven in the phase 3 trials, and it's still evident now that you will not require hospitalization or die of COVID if you've been vaccinated. It's just clear. I mean, we've been going through this now for a year and a half, and those numbers are still holding up.
Well, I wanted to ask too about the recent calls for wearing of masks again inside. When you go inside and when you're especially when you're in a crowded place inside, even individuals who have been vaccinated. What is the thinking there? Why do even vaccinated people need to wear masks inside?
Well, because this Delta variant is so transmissible. You know, the most contagious virus up until now that humans could acquire was chickenpox, extremely contagious chickenpox. But we now realize that the Delta variant, the other variants weren't, but the Delta variant is as contagious as chickenpox, which is really something to say. So even though you're vaccinated, there's still a small chance you could get COVID, but you have so many more viral particles, Delta variant, in your system if you get it. You may have no symptoms, be pre-symptomatic, and you don't want to give it to the 66% or 70% of the people who may not have been vaccinated already. And that's the key. You know, unfortunately, boy, there have been so many mistakes about masks. And, you know, I don't want to rehash that, but wear a mask, don't wear a mask. It's not helpful. Yes, it's helpful. There's clear evidence, at least you can look on the CDC website if anyone's interested, under their science section, COVID-19 science section. And there are about 50 articles that will attest to the importance of wearing a mask and the reduction in transmission of viral particles, or at any rate, you're going to reduce transmission. You may be vaccinated and have minimal symptoms and unlikely to have COVID, but in the event you do, you don't want to spread it to somebody who has been unvaccinated. And this, in Northwest Georgia, about a 65 to 70% chance you're going to be in a crowd of people with 65 to 70% of them unvaccinated. So I've been wearing a mask again, just because of those statistics. I'm fully vaccinated. And I just, I don't think I'm going to have any exposure, but in the event I may have an exposure and have minimal symptoms or none, I just don't want to give it to anyone who I could make sick. It's just so easy to wear a mask.
Do we have an idea yet of whether or not a booster shot is going to be necessary or recommended?
I think the answer to that, Dr. Hershey, is yes to both. There's pretty good numbers saying that right now in immunocompromised people with organ transplant, people with cancer therapy or some sort of immunosuppression of any form, even people without a spleen, they're going to require a booster. I really think, and that may be coming pretty soon. I also think that we're going to need a booster for the general population after you've been fully vaccinated. I do not know when that time frame will be, but according to articles in the pre-published journal articles, the extent of the decline of neutralizing antibodies in somebody is about 6% every 2 months. So it appears that maybe at 18 months, people will need a booster. And that's just my impression. That's not public health recommendations or the CDC, but from what I read, yes, we will need another booster shot. And it does show significant increase in neutralizing antibodies when you get a third booster, no doubt about it.
But currently, those are not available.
Not yet. And the reason is, number one, they have not gone through any phase 3 trials, and it's all regulatory at the FDA level. They have to get, I think, licensing and all that other stuff that goes along with another shot that they're recommending. So it's all these regulatory issues that have to be taken into account.
Dr. Voccio, quick about the numbers, and you may be able to answer this. Across the board, are certain demographics doing better than others in regards to the vaccination?
Oh, yes, Greg, I just got this right before we came on. I was sent this by our epidemiology office. In Georgia, 37% of Blacks, 42% of whites, 78% of Asians, and 95% of mixed or other race have at least one dose of the vaccine. 38% with Hispanic ethnicity have had one dose of the vaccine. So 37% Blacks, 42% whites, 78% Asians, and 38% of Hispanics have at least one dose. So those are the numbers as of today.
So African Americans are lagging behind everyone.
Yeah.
With vaccinations.
Yes.
At least one dose. Mm-hmm.
Yeah.
Which
that's just the hesitancy that you talked about. That it's just a reluctance in African Americans, and 42% of whites. That's not a good number either.
That's very troubling for me when knowing that African Americans suffer from more preventable diseases like high cholesterol, high blood pressure, diabetes.
Yeah,
we're the most vulnerable to the disease, to the virus, and yet we're the least vaccinated. So it really creates a conundrum for the African American community.
Yes. Well, I've spoken to many people, John Ware and other African American community leaders, and trying to get the word out. It's just so important.
Oh yeah. Well, I agree. I mean, I think we're working in the community, but it's there's a lot of barriers that we just got to keep chipping away at to increase those numbers.
At one shot at a time.
Yeah.
Well, we have less than a minute to go, but I think if nothing else, we have expressed that vaccinations are important. They need to happen. People are reluctant, need to get over it and get a shot or get two if that's the vaccination they're getting.
Correct. Yeah. The risk of getting COVID and side effects, long-term side effects of an infection, including dying, are so much greater than the side effects of the vaccine. I just can't reiterate that. So it's just so important to get a vaccine.
Well,
and we're going to be experiencing SARS-CoV-2 for a long time, I'm afraid. I mean, this is going to be up and down, up and down, up and down, outbreaks, hospitalizations. And by the way, wanted to say again, I know I said it early on, Dr. Hershey, but this morning, Floyd Medical Center had no critical care beds available. They're in high double-digit COVID cases, as is Redmond. There are only a handful of critical care beds available in Floyd County. It's just very, very worrisome.
Well, we're going to have to end it there, Dr. Voccio, but we appreciate you so much, and we will have you back soon, I have no doubt. So
I will be here. Thank you very much for letting me participate.
And thank you for joining us on Community Watch this week. See you next time.
Thank you.